Hi everyone, I am Shafiq Khan and today I will talk about some confusing drugs. These drugs were confusing to me when I was in third year of MBBS, so I decided to make a video on it to make it easy for my juniors. There are some drugs which sound somewhat similar but they are from different classes like Amiloride, Amiodarone, Amlodipine. You can use this video for self-assessment as well by pausing it intermittently and answer these drugs. And in the next slide, I will give brief explanation about these drugs. Amiloride is a potassium-sparing diuretic. It is an antihypertensive drug, but it is mainly used for nephrogenic diabetes insipidus. Other drugs from this class, others potassium-sparing diuretics are spironolactone, eplerenone, and triamterone. Amiodarone is a class 3 antiarrhythmic drug. It is also a potassium channel blocker and it increases the action potential duration and it increases the QT interval. It is used for atrial fibrillation, atrial flutters, but mainly used for ventricular tachycardia. The main adverse effect of amiodarone are pulmonary fibrosis, hepatotoxicity. It either causes hypothyroidism or hyperthyroidism. Amlodipine is a dihydropyridine calcium channel blocker. It blocks the voltage dependent L-type calcium channel of vascular smooth muscle. It is used for hypertension, angina, including presmental angina, Raynaud phenomena. Then the adverse effect of amlodipine are gingival hyperplasia, peripheral edema, flushing, and dizziness because of increased peripheral hydrostatic pressure due to precapillary arteriolar vasodilation. Now another three confusing drugs: Etanercept, Exenatide, and Liraglutide from the same class, and Ezetimibe. You can pause it here to answer these drugs, and I will explain in the next slide. Etanercept is a tumor necrosis factor alpha inhibitor, TNF inhibitor, and it is produced by recombinant DNA. Etanercept is used in rheumatoid arthritis, psoriasis, and ankylosing spondylitis. TNF is important for granuloma formation and stabilization, and if you give someone the TNF alpha inhibitor, so it will predispose to the infection, including reactivation of the latent TB. And one adverse effect of etanercept is also drug-induced lupus. Exenatide and liraglutide both are from the same class. Both are glucagon-like peptide 1 analogs, GLP-1 receptor full agonist. They decrease the glucagon release, they decrease the gastric emptying, and it both increase glucose-dependent insulin release and increase satiety. Adverse effects are nausea, vomiting, pancreatitis, and they promote the weight loss. Ezetimibe is a lipid-lowering agent. It prevents the cholesterol absorption at the small intestinal brush border. It decreases the bad lipid in the blood, which is the LDL, decrease the concentration of the LDL, and its adverse effect is diarrhea. Now another two often confusing drugs, Benztropine and Bromocriptine. They are a bit easy. Benztropine is a cholinergic antagonist, or you can say muscarinic antagonist. It acts mainly on the CNS and it is used for Parkinson's disease and acute dystonia. Bromocriptine is the ergot derivative dopamine agonist and it is used in Parkinson's disease. Both of these drugs are used in Parkinsonism. Parkinsonism is due to the loss of dopaminergic neuron and excess cholinergic activity. So, bromocriptine is a dopamine agonist which increases the dopamine activity, and benztropine is cholinergic antagonist which decrease the cholinergic activity. So both are helpful in Parkinson's disease. I will upload couple of videos like this, and thanks for watching.